Learning outcomes for the module on peak expiratory flow rate. In this module, we will cover the following points, following a step-by-step approach while discussing the process with the patient, preparing the tray and detailed cleaning instruments, performing the procedure with the utmost care, observing the peak flow chart and guidelines to fill the same, effective interaction with the patient before consolidating the procedure.
So this station is peak flow, and it's a station, again, you don't need to do the full ID check, you just need to show the procedure that you know how to do it effectively and teach the patient it. It's usually used to monitor asthma and sometimes to diagnose asthma. So we're going to be probably in a sort of clinic setting. I'll go through the procedure now with you and show you how it should be done. Okay, so I would again declare the area safe to approach, do the hand hygiene, 7 steps. I would have introduced myself, checked their identities correct, their allergy status, the pain score, their comfort, and that they're feeling well enough today to do this procedure. I also would ask the admitting nurse or assistant whether they have normal OBS and they're within normal range. So I would screen the area for privacy and dignity, shutting the doors and curtains and closing any windows. And I'll just go away and gather my equipment and come back to the patient and go through the procedure with them. So I'll gel my hands because I'm leaving the patient area. I'll assume that this tray has been washed with soap and water in the last 24 hours. I'll give it a quick wipe with alcohol wipes. I'm not going to wear an apron because I'm just going to clean the tray quickly. So that would go in clinical waste. If the peak flowmeter is in a sealed pack, I wouldn't clean it, but if it was a broken pack, I would clean it with an alcohol wipe. If it has a disposable mouthpiece, I would put the disposable mouthpiece in the tray and the peak flow meter. Get rid of these gloves, and I would gel my hands again. I would return to the patient with the equipment. So I'm back again now, and you're still happy to do the procedure. So I'm just going to run through the procedure and what it's for. So we're going to take a measure of the best expiratory rate you can breathe out in a short, sharp huff. And this device, this handheld device called a peak flow meter, will read it. And we will take 3 readings. And the best of those readings we will take as your peak flow reading. And with that, the doctor can look at whether your medications are working and can see whether perhaps you should stay on the same treatment. And you've already told me that you've taken your inhaler this morning, so I'll take a note of that, and that your OBS are within normal range. So are you happy to proceed? The patient says they're happy to proceed. So what I'd like you to do is I'd like you to sit up straight. If you could stand would be better. The patient tells me that they can't stand today. They're feeling a little bit wobbly, so I'm going to allow them to stay sitting. I want you to sit up straight, look straight ahead, put your shoulders back, and I want you to take this handheld device in your hand. We're going to put the dial to 0, and I want you to take in a deep breath, deep as possible. Put the mouthpiece in your mouth and do a short, sharp huff, and the dial will go up along the meter, and I'll take that reading, I'll give you a rest, and we'll repeat that 3 times. If the top 2 readings are more than 40 litres per minute apart, we would have to take another 2 readings if you feel up to it. Is that okay? Do you understand everything? Patient says it's fine, and I'm going to carry on. So, if you would just sit up straight with your shoulders back, take a deep breath in as possible. Put the mouthpiece in your mouth, avoiding your tongue on the mouthpiece, and make a tight seal with your lips. Now do a short, sharp hoof, and the examiner will move the dial, and I will come over to my chart and put the reading down on there. So, examiner, what time is it? The examiner tells me it's 9 o'clock in the morning, and the reading is 490 litres per minute. So, would you like to have a rest? The patient said they'd like a rest. 2 minutes has elapsed. Do you feel okay now to carry on and do another reading? Yes, he says he's fine. So again, I want you to do the same thing. I want you to take a really deep breath in, and I want you to get your shoulders back, head straight forwards, hold the meter without impeding the dial, and make a nice tight seal around the mouthpiece, not letting your tongue impede it, and do a short, sharp hoof. And this reading is 5:10. So examiner, what time is it, please? So it's 9:03. The reading is 510 litres per minute. Okay, so final reading, hopefully. How do you feel? Do you feel okay to take another blow? Yeah, I'm okay. Right, so the patient doesn't need a rest this time. I want you to put your shoulders back and do the same thing. Take a deep breath in and put the mouthpiece in, sealing your mouth tightly around the mouthpiece, avoiding your tongue, and blow out short, sharp hoof. And that reading came out as 500. So I would put the meter into the tray and examiner, what time is it? It's 9:04 and the reading was 500 litres per minute. Okay, so the 2 top readings we have are 510 litres per minute and 500 litres per minute, which means we don't have to do another 2 blows. So that's all done now. I'm going to look at the graph, and the graph tells me, according to the patient's gender, so male and female, and their age and their height, how much they should be blowing. That's the expected peak flow for a person of that age, height and gender. So this patient is 167 centimetres and it's a male and he is 30 years old. So I would look at this graph and I would look at the male section, 167, and I would look at where it meets the age line 30 years. And it says they should be blowing 610 litres per minute. So his top reading is below what is expected. I do have to give the patient this information and tell them what I'm going to do with it. So I would also write down for the final reading here that the best reading is 510 litres per minute, and the expected is 610 litres per minute. I'm going to go back and just explain this briefly to the patient. So I've looked at your readings and I've looked at them against the graph, and it appears that your reading is below what is expected of your age and height and gender. So your best blow was 510 and the expected was 610 litres per minute. So with those numbers, I'm going to take them, give them to the doctor, and they will look at those values and they will get back to you and let you know if your treatment plan stays the same, and they'll be in touch with you soon. And if that's okay, do you feel okay? Patient feels okay. I would give them the buzzer. I would decontaminate my hands. I would go and take this information and store it confidentially in their nursing file. I would clean the peak flow meter. And if this was a disposable mouthpiece, I'd throw it in the clinical waste. I'll also clean the tray and leave them to dry and put that in the clinical waste. And once again, I'm going to gel my hands. And that is the end of the peak flow scenario, the OSCE.